Hi, and welcome back to the third annual Global Health and Wellbeing Coaching Symposium by YourCoach. I'm Dan Kendall, the founder of Mission Based Media and the executive producer on many health podcasts, including the new Health Unmuted audio library. I'm really pleased to be leading this discussion around the anatomy of a thriving health coach. There's a lot to unpack in that title, and I'm very excited to have Coach Meg Moore, Margaret Moore, join me on this conversation. Meg is an executive coach, a coaching leader, and an entrepreneur. And she spent 17 years in the biotech industry before founding her Well Coaches Corporation in 2000. Her school of coaching has coached over 14,000 health professionals in 50 countries. A decade later, in 2010, Meg co-founded the National Board for Health and Wellness Coaching. It's a nonprofit subsidiary of the National Board of Medical Examiners, and they establish coaching standards, coach certification, and CPT codes and healthcare reimbursement of coaching services. We're going to touch on that a little bit later. There's another symposium going on about that same topic. It's a really important aspect of building this coaching industry. She's also co-founder and chair of the Institute of Coaching at McLean Hospital, which is a Harvard Medical School affiliate, and a course director at the Harvard Medical School Coaching in Leadership and Healthcare Conference. In her free time, Meg is co-author of 4 books, 10 book chapters, and 23 peer-reviewed articles. Meg, thanks so much for joining me. Welcome to the symposium.
Well, hello, Dan. I was really looking forward to being back with you. So I'm so glad this is happening.
And Meg, you and I spoke last year. A lot has happened in the past 12 months, but even more so, you captured an article that's available on your website, Well Coaches School. You really captured what's happened in the past 14 years, from 2009 to 2022. I really want to dive into this question of what is the anatomy of a thriving health coach. But before we get to that, can you just give us a little bit of an overview of what you covered in that article and what you covered in your leadership roles across the 14 years from 2009 to 2022?
Thank you, Dan. Yes. When I started in this field, the vision I had and have is to bring the professional coach into the healthcare space as a new profession. And building a new profession is a long-term journey. And, we're in our 3rd decade now. I'm in my 3rd decade on this. And the first step was to build science-based coaching curriculum that didn't exist in the broader life and business and leadership coaching industry at that time in 2000. And that's what Well Coaches did. We built the first science-based protocol. And then after training, our first probably 10,000 coaches, we then had 22 peer-reviewed studies on the outcomes of our Well Coaches protocol, which is also in our manual. That's one of the books that I've co-authored. And so that bringing from biotech, this understanding that you build something and then you test that it works. You make sure the principles of what you've built are science-based, and then you test that. So that was the first decade, was getting that foundation. And then in order to build a health profession, you've got to have national standards for training and education, and you've got to have a national credential. I mean, most healthcare professions, if not all, are licensed. They have state licenses, but what goes before and what allows a state license is the national standards and the national credential. Medical school, nurse, and medical licensing exams, nursing, social work, physical therapy, on and on and on. So we had to do that. So by the time 10 years had passed, we had a group of us, around a dozen, that were training health and wellness coaches and in the article, I list all the original founders. There was about a dozen of us. And we came together and agreed that even though we were competing in the marketplace, we knew that we had to agree on a common core and build a certification. So that was the next 10 years. And that turned into the National Board for Health and Wellness Coaching. The thing that is easy to drive past and forget is in those early days, we had health coaches, lifestyle coaches, wellness coaches, integrative health coaches. And there was a tension there, which is they're all different. And so one of the most important things that I drove and others agreed is that we had to have one coach, the coach that can be health, well-being, wellness, lifestyle, integrative health, functional medicine, whatever, that the coaching competencies were common and they were science-based for all of that. So that was the first big achievement. Then we defined the job, and then from there we found a partner in the National Board of Medical Examiners to help us build the competencies, the exam, and then once all that was set, and we formed a new entity, which is a nonprofit affiliate of the National Board of Medical Examiners. They invested millions of dollars to get us to that place. We then began the process of getting billing codes, so the coach could have services to be delivered in healthcare that would be paid for of substantive size, so that it could create a job. And so we figured out a range of codes that were existing codes, with the VA at the helm in terms of getting the new coaching codes approved. We got those done in spring 2019. And that's evolved. We've been back to the American Medical Association CPT panel now several times. And then early next year, we will be applying for the full status. So we were category 3, which is step 1. And now we moved to category 1. And we've got a team of 15 people working on all the data pieces that go into making this case. So that's the journey, right? The vision with nothing happening to reality. And that's a leadership journey. And I think that's, for me, that's probably been the biggest gift of this, is that it's made me a better leader.
Well, it's been an amazing journey over a few decades. And as I mentioned, you were a biotech executive for 17 years before you embarked on this journey. So you've got some wonderful skills and perspectives on the healthcare industry and health in general for people and for populations. And I think it's important to understand how this whole industry has evolved in such a short period of time, led by individuals, including yourself, that are really making this happen for a lot of people who are watching this video now. So as people are now looking at all of the foundation that you and others have laid to create this industry, I'm curious about how people understand about how they opt into it. I mean, if you want to become a doctor, if you want to become a nurse, if you want to become other kinds of therapists, it's pretty clear from an early age, partly through exposure and going to a doctor's office, meeting a nurse, having a nurse in your school, having people in your social environment where people are doctors, where you might get exposed to that and understand a little bit about what the journey is. But I think when people are looking at becoming a health coach, the journey probably starts much later in their education. I'm curious about what it really takes and what kind of people should be looking at health coaching as a viable career opportunity for themselves.
Yeah, thanks, Dan. It's a really important question. Up until now, for the most part, moving into coaching is a second career, like for me. It's generally, it'll eventually, and we're getting closer and closer every day, coaching skills, coaching processes will be integrated into all the health professional schools, medical school, nursing school. So that's going to happen. It's going to become a universal set of skills. If you're a teacher, a parent, everybody, these are the skills of having powerful conversations. And so I think the thing for coaches to realize, there's so many people that are unhappy in healthcare right now. As we know from the burnout statistics, that there's a real yearning to truly help people without the constraints that of all the constraints, technology, regulations, financial, quality control, all those drivers have taken the life out of conversations between healthcare providers and patients or clients. And so there's this enormous yearning to spend time doing that and to do that well. And so that's great. And so to some extent, there's a big wave of people. There's many more people that would like to be coaches than there are jobs right now. I mean, that's why one of the reasons that everybody sees that this is the future, but we're not quite there. The future's not quite, we're building it, but it's not quite there yet. So, and at the same time right now, and this is not just, I was just speaking to a close friend and collaborator for many, many years about the leadership and business coaching side. We have an oversupply of coaches and an undersupply of great coaching. And great coaching is a conversation. It's a conversation that's not scripted. It doesn't have a checklist. Certainly you have a process in the back of your mind. You've done it over and over, but it is a very emergent, creative conversation that is generative. It is a creative conversation that allows people to think and feel and then behave in ways they did not think were possible when they started the conversation.
Right.
And it's that ability to deliver insight, to create a conversation, to hold the space and shape the conversation so that people come away and say, my gosh, something happened there. Like something shifted. Like I've shifted. I mean, we know from the biology of neuroplasticity from Alvaro Pascual-Leone at Beth Israel that the brain can only grow, the biological limit is 1 millimeter of neural network a day. So you're not going to transform your mindset and behavior in one conversation, but these small shifts that energize you, right? Because you feel stuck, right? People feel stuck if they're not healthy, mentally, physically, don't like their work, they feel trapped in that. That's the phenomenon. You don't know what to do. Like, you're just, if you knew, you'd be doing it, right? And as we help people kind of get out of that the system, that the worldview that they're living in, it feels good because it gives you hope. Oh, wow, I can change myself. My mindset, I can actually look at the situation with what activated me yesterday is not today. What I was doubting yesterday, I'm confident today. When you start to feel that, you start to have hope. You start to believe, yeah, I can actually get healthy. And so that is not a trivial skill set. I mean, I'm still getting better. All of us are still getting better. And so I think people need to lean in and not just say, oh, this is the hot new thing. That's not going to get us to the finish line. We must come to this being humble and continually upping our game in how we hold that conversation.
Yeah. It's funny, as you were describing that, if you go back 60 seconds, some of what you were just saying could apply to the potential health coaches of tomorrow, but it also is of the people that health coaches are working with, that neuroplasticity, that changing. So it's about changing the coaches' mindsets as coaches and also changing the people, the clients that you're working with. So I'm just curious, are there certain personality traits that you find are attracted to this profession, and not just attracted to it to do it, but that can be in that top 10%, that A plus performance of the health coaching industry?
Well, there's a couple of things to say. One is, I'll use my own example. When I started in this field, I was a CEO. I'm an MBA. I was CEO in the C-suite since my mid-30s in biotech. So I didn't think of myself as a coach. I wasn't planning on becoming a coach. And for various reasons, I had to. I was giving talks, and people would be sitting there thinking, "Well, I'm already doing coaching. What have you got to offer?" And so I'd have to make it happen in 15 minutes. I'd have to produce an aha moment in front of their eyes for them to realize they weren't doing it. And I discovered I had this intuitive ability to be really present in the moment and to see the potential of the moment. And I didn't even have words for it. So a lot of us don't even know that we could do this because we have cultivated an identity and a competence that is about filling the space, not holding the space. And so I didn't know I could shift so significantly when I was really wanting to help the other person. Like I kind of knew what I had to do, which is I had to get out of the way, and I had to be in a much more reflective, responsive, creative, provocative, challenging way. I had to be different. And I can't say that I didn't go to coaching school. I built a coaching curriculum that didn't exist at the time, that came from my own, and a lot of collaboration with some very special people. So I think you don't necessarily want to assume ahead of time that you don't have it. What do you need though? You need deep empathy and acceptance for the human condition. Because if you're in a judgmental place, and a critical place, which is, of course, we all have judgment, but when we're trained, especially if you're in a healthcare profession, your judgment is what you rely on to avoid bad things happening. Judgment is key to peak performance, but judgment is the enemy of a good conversation. So what you rely on to be effective and successful and to avoid catastrophe is the thing that gets in the way in a human relationship. And not everyone is able to get that and to be really accepting. So it's that's one thing. So, you know, I went through hell in my 30s. And if you're wondering why I have a black eye, I fell a week ago on my cheek. So that wasn't hell, but you know, just wanted a name. If it's in the room, you know, you guys might be thinking about it. But I did go through hell, not physical hell, but emotional hell in my 30s. My mother died. My first husband left me for a close friend of mine. I was lost. And I had to walk away from a huge career in the pharmaceutical industry. So in one moment, so a career I'd built over a decade. My mother was my closest family relationship, and I adored my husband. All were gone, like within a couple of years. And so I hit bottom, and I didn't bounce back for a while. You know, I functioned, for sure. I functioned. Yep. But I learned to sit with pain. And I can't, honestly, I don't know that I'd be where I am today if I had not been through that. And I think those of the coaches who are listening will understand what I mean. Real adversity gives you real empathy. It really does. I mean, thank goodness something comes out of it.
Yeah. Wow.
Right. So you've got to be in a place, because look, when people are unhealthy, the story behind that goes down layers and layers. And we're not therapists. We're not going to dive down and repair and integrate all the trauma and all of that. We're working at the surface, at the topsoil of people's lives. But we have to be able to not judge, to be in a place of acceptance. And that takes a lifetime to get better at too. You know, even though I came in with that, I can still fall back into judging myself. There's all the time. So that's a really big deal. And
empathy, empathy, you mean, is a big deal.
The compassion and it's acceptance. It's but two different things. Empathy is relating. Acceptance is not condoning, not wanting it to be better, but not arguing with it.
And because that's what I was wondering, is if there, I mean, because what you just described in terms of your personal experience, I'm really sorry to hear that you've gone through that. I think that, you know, many of us, when we live long enough, we do have experiences where we hit bottom. And if you haven't done it yet, if you're listening and you haven't done it yet, then stay tuned. It might be coming, because it happens to a lot of people along the way. And I think it's really around how you can respond to that. But you can't learn that experience. That experience is something you obviously experience. So I'm wondering if there are other things in addition to the empathy that some people might have innately, you know, without having gone through that trauma, or their trauma may have occurred earlier in their life. They may not even recognize it as that. It may have just been their life or their childhood. I'm wondering if there are other things that coaches can cultivate that will put them in that top 10% of performance.
Yeah. So that's all about the starting place with people, because people are not going to feel safe or trust you or want to play with you if they don't feel as though you're with them, you get them, you're not judging them, and you're creating a space. The second part is the potential. What's the creative potential in the moment? And that's a completely different state. And that's the ability to be present to people's conversation, what they're saying, how they're saying it, what they're not saying. Like, so you're listening to thoughts, words, thoughts, emotions, meaning, what's not being said. So you're picking up a lot of data, right? A lot of data. And you're helping them. So if you want to generate insight, there has to be a focus. What do you want? Where do you want to shift? What shift do you want to make today? What needs? And they might not put it in that language, but you know, what do you want to get better at today? What's up? What are you being called to examine and explore and shift? And Well Coaches we call that the generative moment. It came out of a team that I led in 2004. We built a theory for what's called the intuitive dance of coaching. And the intuitive dance is it is a flow state. We called it relational flow. So flow is when you're in a groove. And this is a groove of a conversation. And it's very much a back and forth. You don't know where it's going. You're not attached to where it's going. It is truly a creative conversation. I mean, it can be a brainstorming conversation, or it can just be there's lots of different tools to do this. That's something we teach at YourCoach in our core and advanced trainings, lots of ways. But the core of the warm up in a coaching session is the empathy, acceptance, what's going well, generating positive resources. I didn't get into that, but you got to have some zest. This is not, you got to really bring, people have to leave with more energy, more motivation, more confidence, more self-esteem. Their obstacles look smaller, their possibilities look better. That has to be, that's part of what the generative conversation leads to. So you're accepting, you're generating the positive, and then you're allowing this generative conversation, which can be done in maybe 10 minutes, 10, 12, 15 minutes. But you can't do it in a 20-minute conversation, because you have to have a warm-up. People are not ready to go into a creative, like, what about this? And what if you did that? And what would happen if this happened? And what would that look like? And if if that part of you had a voice, what would it say? Like, that getting people alive, getting the, neurons firing, getting them like, out of the, well, I could wear a Hawaiian shirt and then it would make me feel like I'm on the beach and I'd have my beach moment. And then I could, you know what I mean? You got to get the energy going, right?
Right.
So, and then out of that generative piece comes, okay, what do you want to do next? What are you going to do? So you take the energy of I just had a shift. I just see something differently. Then that turns into action. And so the insight to action is the iterative process over time that lays down the new neural network. So that's the whole, that's the whole kind of piece in a nutshell.
Well, I wonder, I mean, the word coach is both a noun and a verb. And I think when we typically think of coaches, I mentioned where we, throughout our lives, we interact with nurses and doctors, and our coaches are the ones who are telling us what to do. They tell us to run this drill, run this play, swing the club this way, hold the ball this way, pass this way. They're telling you what to do. But maybe it's a misnomer, because health coaches are not giving that sort of instruction, right? It's trying to pull out, my understanding is, based on the question you just described, is you're trying to pull out from the client that you're working with, what it was going to work for them, what their motivation is, and how they can change. Is that an accurate sort of statement?
Right, yeah. What came to mind when you said that is Sir John Whitmore, who was one of the early coaches in the UK. And he's passed now, but there's a video of him, and I can send it and share with the group, of a golf lesson with a directive coach versus a facilitative coach. And it is brilliantly done. And you can see how the client of the coach, who's letting the person find the swing and find, with a little bit of guiding, but much more facilitating, and you watch the person come alive compared to the do this, put your hip over here, move this, that, and then people are like, okay, I'm going to do it wrong for sure. I'm not going to do it right. I'm not going to find it. I'm going to lose it. Right. And so when you watch that, you realize that humans do better when someone empowers them. There's still need for education, and in health and wellness and well-being coaching, the literature shows that we all provide some sort of education we're not in the driver's seat, we're still in the passenger seat, offering, would you like to know about this? Would this be helpful? What would be the thing you'd most like to know more about right now? As opposed to, here's what you need to know about blah, 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 based on your assessment. So they're still in the driver's seat, where am I going? Oh yeah, I'll take that. No, I don't need that. Oh, I need that. So then we are giving tutorials in an energetic way, which is helping them take in some new information, which they need. And so that's part of building confidence and competence, is you get the knowledge you need at the moment that you're experimenting with new behaviors. Yep. So it's not that we never give advice. We just don't give it the way we used to. We don't hand people.
So I need to move on. We've only got a little bit of time left. I need to move on to another topic, but I just want to ask this in a different way. If I had a room with a stage with a curtain across it, and I said the top 10% of coaches are behind that curtain, before you see them, before you meet them, I want you to describe their skill set to me. They're the top 10%. What would you use to describe the top 10% of health coaches that are behind that curtain?
Just a infectious zest for life, for growth, for experience, for whatever's next, the sense of adventure. Because this is
How about their skills?
So that's the curiosity. Then that from there comes curiosity. From there comes questions. From there comes a sense for where the other has an opportunity to grow. We call that the growth edge, the ability to detect that, maybe not be accurate, but to know enough to be able to play around. Where do you want to shift? The ability to help people walk through generating insight and turn it into energizing action. So, I already mentioned the empathy. So we'll assume the empathy and the acceptance, self-acceptance is there. And then the other thing is that we're as coaches have to have more consciousness. We have to be further along in growing ourselves than our clients, so engaged fully in their own learning and growth. So you're walking the walk.
Right. And one thing I want to make sure we touch on is that, we see technology impacting every area of our lives. So I'm really curious about the role of technology when it comes to coaching. We're certainly seeing it in various aspects of healthcare as well. After a somewhat slow start, some of it's been mandated and required just to be able to provide any level of healthcare during the pandemic. I'm just curious what your views are about AI and machine learning and other tech tools, and what role that has to play in the health coaching experience, and maybe some things that we should be looking at, and maybe some things that we should be avoiding where the human touch is more important.
Yeah. Well, the all of the things I've spoken about are deep human qualities and skills that are not going to be done by machines. Machines are not creative. And what we want to do is to delegate. So we don't want the tech to get in the way of the productive, if not empowering, powerful conversation. And so it can, right? Tech distracts us all the time. The powerful connection, especially if we're in the same space, but we've been able to get pretty far with Zoom. That is what is transformative. It's when another person is with you on this journey, that there's nothing, you can't replace that. And the challenge with a lot of models with tech is that they're trying to reduce the cost of the intervention by reducing the amount of human conversation, and then it becomes a very superficial situation, which doesn't lead to enough reflection to get to any growth. So the tech gets in the way of really high quality coaching. I mean, you can still pick an app to follow step by step, and that can be really helpful to you. So there's plenty of places for tech. But if you want if you want the most out of coaching, then you got to keep it out of the way, not interfere. The area I think where it needs, and we actually filed a patent on this, and I have done a little bit with this. The area that's tedious is making habits. By that I mean, okay, now you know that you want to sleep better, and there's a dozen different ways to go after that. So in the coaching conversation, you can kind of figure out where do you want to start, like where are the things before bed, what you do in the middle of the night, like where do you want to start. But then there might be 10 different habits that you do. So I would love to see the tech be the digital coach with you. Okay, did you try that habit? Did it work? Do you like it? Do you not like it? Here's another one. Here's a video tutorial. So the habit making part, which is what apps do, right? It's the last mile. It makes a lot of sense. I would love to have a bot. I mean, it was my brother's birthday yesterday, and Apple served up this memory photo collage for my brother that I hadn't even thought of, and somehow it knew that was my brother. His name was in my calendar, and that was magnificent help, right? Like some really useful thing. So tech is amazing, but doesn't help with a conversation.
Yep. Yeah, excellent. I've had those memories as well, and they are. I'm so pleased that they do that, because it's nice to see that. And then you think about how could they transform that into something that can make a real substantial
Yeah, there's
impact
so
for the
much
person,
more we
and
can
be
do with
motivating.
that.
Yeah. So as the body, last question for you, Meg, before we need to run. So that the body of research is really growing now, and we're really pleased to see the positive impact that's being documented and validated of health coaching. So I'm really curious, what is the future of this role of health coaches? I mean, is it something where the Department of Labor is going to recognize it, like to do with health educators, for example, or where does where does this take us as we look at all the history and where we are today?
Well, we're well on the path for it to become a profession, and all of us in it consider it a profession. Is it a mature profession? No, not yet, but it's moving in that direction, especially if coaches are really dedicated to mastery, which is what we've been mostly talking about today. If coaches are looking to be masterful, and they're leaning in, and they're not they're understanding why mastery matters for a new profession. I mean, other professions didn't have to meet that test, but now we have to be masterful. The conversations have to be powerful. We have to have return on investment. So we still got more to do, but absolutely, this will become a key role on the healthcare team in primary care.
Excellent.
It already is happening, just not everywhere.
You scale it.
Yeah, the other side that Well Coaches is moving into, so this provides coaches a second track, has to do with work well-being, which is the major driver of overall well-being. So the more satisfied you are with your work and your life, the more likely you'll engage in health behaviors. And we have to start there too. And so we've just built a well-being inventory that covers mind, body, work, and life. And it's work-centric, but it still gets at the others as well. And all of the constructs that drive a thriving work life are the scientific constructs that are embedded in coaching protocols. We didn't wander off and do something weird. We're actually standing on top of the constructs that are, so coaching in itself, the what we do, what we ask, and where we take people in of itself is a well-being intervention, even if you don't talk about well-being. So we're naturals to address the huge yearning and need for much more human well-being, not just on the physical side and not just on the emotional side. So I think that, and take burnout. I mean, we all as coaches need to be good at helping clinicians with burnout. We need to know how to have those conversations and help people move forward. So this has actually given us a whole new, I mean, it's sad that it's needed, of course, it's terrible. But the Gallup data, right? Engagement is, high engagement is 20% of the population, the Great Resignation, all of that. So, and we can blame employers, and we can tell them to fix the environment and fix the culture, but in the end, only what gives you flow. Where is your groove? When are you in your groove? How do you find it? How do you hold on to it? How do you not pollute it? How do you actually have a day where you're grooving? You can't delegate that to somebody else. You have to find it yourself. And that is where coaching is really powerful, because we can help people stand on their own 2 feet and groove.
Yeah, that's great.
Right?
Well, Meg, that's really great. We're at time now, so I need to end the conversation, but I could listen to you all day. Thank you so much for making time to speak with me and with all the viewers and participate in the symposium. Really fantastic work that you've done over the past several decades, and the lasting impact of your legacy will go on far, far, far into the future. And I'm excited to see what happens next, and especially for all the viewers who are coming into this industry now, building on what you've done and the water you've been carrying for so long. I want to thank YourCoach.health for their excellent team for organizing this event and for having me as the host of this conversation. And I'd also like to thank you, the viewers, for taking time to tune into this and for your interest and commitment and work that you're doing to help people and populations in their improving their health and care. Be sure to stick around for more great sessions, and thanks for being a part of this program.
Thank you, Dan.